In this session, we'll review patient statements and generating those patient statements. To begin, navigate to Report Central. Your reports are available under the Reports tab. Navigate to the Patient section and click on Generate Patient Statements. Patient statements can be ran at the frequency decided by the office. Statements will include any insurance payments and adjustments, as well as any additional messages that the practice wants to add to the statements. Statements can be run by legal entity, by specific patient, or by case type. If you only want to run statements for those patients with a cash case, you can select that case type. We can also set an amount due to and from, as well as use an appointment date to and from to help break down our statements. We can also run based on an alpha split, using patient last name between and using the drop box to select the alpha split we want to run the statements for. If we're running for the entire alphabet, we'll need to leave this blank. We can also run statements based on a different set of date ranges. The system will default to an as-on date, but statements can also be run by a date of service range, by a specific aging bucket, or based on the last run date. If messages are needed for your statement, type your message here, and it will be generated on your statement. Once you have the parameters to your desired patient statement needs, click Generate on the right-hand side. Your statements will appear on your screen in PDF format and can be printed to your printer.